Hi, I'm Ashley McIntyre and I'm the lead clinical educator for Advatx. I am a registered nurse with a certification in dermatology and I've been working in dermatology and aesthetics for 9 years. I'm currently the lead injector and director of medical aesthetics at a medical spa in Denver, Colorado. At my practice, we use the Advatx laser multiple times a day. We love the Advatx laser because it treats melasma, acne scars, sun damage, vascular lesions, rosacea, and skin tone and texture for overall restoration of dermal health. Once you power on your laser, it's going to bring you to this home screen. The home screen is split into two, with 589 down the left side and 1319 down the right side. It's as easy to switch between the two as hitting a button. We'll start with 589. There are multiple preset diagnoses on this side, and to access that laser, all you have to do is click on one. Once you've chosen your indication, it's going to bring you to this screen. On the left-hand side is going to be your Fitzpatrick skin type. You'll choose this according to which patient you have on the table. Once you've selected your Fitzpatrick skin type, you are then able to customize your patient's treatment. At the top is going to be your fluence, how much power you're going to be applying. Easy to adjust with these plus and minus buttons. You'll select your scan pattern, square, line, or circle. You'll select the size of your scan pattern. We're currently in square, so we have an option of 5 by 5 millimeter, 7 by 7 millimeter, and 10 by 10 millimeter. You'll then choose whether or not you want the scan pattern to repeat, and then how much fill factor you want for that scan pattern. If you have a low scan pattern, you're going to have space in between your laser pulses. A medium fill factor, the pulses will touch. And if you have a high fill factor, you're going to have about a 15% overlap with each of your laser pulses. At the top of the screen, you also have a pulse and energy counter. This is to give you guidelines for an efficacious treatment. You also have a line option that's really great for tracing vessels or etched in lines. You can have a line from 5 millimeter all the way up to 10 millimeter. And then you also have the ability to repeat that treatment so that you're constantly applying the laser. In our circle mode, you can treat from 1 millimeter all the way up to 3 millimeters, and again, have that repetition on. Once you've decided on your treatment parameters, hit the ready button. Once you have the yellow triangle and it says laser is ready, you're ready to start your treatment. Once you've completed your treatment in 589, you want to go ahead and hit that standby button to put the laser in kind of the wait mode. And then we're going to go back to our main screen by hitting this menu button. Once we're here, we'll work on the right-hand side of the screen and choose our 1319 indication. In this screen, we'll also choose our Fitzpatrick skin type. We'll set our fluence. And we'll choose very similar parameters that we did for the 589. We'll choose our scan pattern, our scan size, our repetition mode, and our fill factor. Once we've chosen those items, we'll hit that ready button, and we're ready to treat with 1319. The handpiece for the Advatx laser is lightweight and ergonomical. And one of the great things about this laser is that both wavelengths come from the same handpiece. When using the 589 laser, we use a sapphire glass tip combined with ultrasound jelly for passive cooling, which makes the treatment very comfortable for the patient. The ultrasound jelly also improves the conductivity of the laser for more efficacious treatment. When we're finished with a 589, we simply unscrew the collar, remove the sapphire glass tip, and reattach the collar. You also want to make sure that you remove the ultrasound jelly from the face and make sure the skin is very dry before proceeding with the 1319. As a clinician, I prefer the Advatx laser because it has no consumables. It has one handpiece, it's very easy to use. My patients love it, also because there's no downtime, and it's not painful compared to other modalities like IPL and RF microneedling.